Gene therapy is one of the most promising areas of research for RP.
When people hear the words retinitis, pigmentosa, RP, one of the first questions is often, is there a cure? Right now, the answer is no. But one of the most promising areas of research offering real hope is gene therapy. RP is caused by mutations in certain genes that are vital for vision. When these genes don't work correctly, the cells in the retina, the light-sensitive part of the eye, slowly break down, leading to vision loss over time. Scientists are now exploring ways to fix this problem at its root. The idea is simple in theory: deliver a healthy copy of the faulty gene directly to the retina. In practice, it's complex, but progress is being made. In many clinical trials, researchers use a harmless virus as a carrier to deliver the healthy gene into the right cells. If successful, this treatment could slow degeneration and, in some cases, even help preserve or restore vision. Of course, this research takes time. So far, only a few gene therapies have reached real patients, and most are designed for very specific gene mutations. But compared to a decade ago, when this was only a concept in the lab, the progress today is extraordinary. For patients and families, gene therapy represents more than just science. It represents hope. Hope that the future will bring treatments that change what it means to live with RP. This channel will continue to share updates as science moves closer to breakthrough therapies, because every step forward matters and every new discovery brings us closer to brighter possibilities.